Today we start the show with newly elected MMC Ashley Sauls I, who went on the record with his commitment and vision for the Department of Health. MMC Ashley Sauls I, thank you so much for joining us. Congratulations on your election and welcome to Joburg today.
Thank you, Titi, and thank you very much for having me, and hello to all your viewers.
MMC, first things first,
Yes.
What is the current status of the Department of Health? What do we know?
Well, if we have to measure it based on KPIs, because as you know, I'm new in the office, so my dependency now is on the staff to inform me around the status, the current status of specifically the health side of my portfolio, because there's two sides: there's health and there's social development. Yes. Now, on the health side, the KPIs, there are literally 39 KPIs, 21 focused on programs, and then 18 focused on day-to-day operations. And out of that total of 39, the 34 is achieved, the key performance indicators. That is an 87% achievement. Now that's good.
Absolutely.
So if you have to ask me what's the status, based on that information, I would have to tell you it's good. But then because of the type of person I am, I also connect with people on the ground because of my background. So I then realized that I'm not questioning the report. I believe the report. But the reality is also there's a disconnect between what the report is telling me and what the sense is on the ground. So one of the things that we've got to do is we've got to close that vacuum between what is reported and the actual daily realities of our people. And so even though the report, of course, is true, but there's a certain mechanism that they use to come to these conclusions report-wise. But I want to be the type of MMC that if I say to you, Titi, the health department, the status is on this level and it's good, I want that to be consistent with the daily experiences of people.
It must be an accurate reflection of, an overall accurate reflection. So that brings me to my next question, MMC, which would be, you just outlined a priority for you, but what other priorities have you outlined? What have you observed in terms of your portfolio?
From the health side, I think because I have a mother who uses, well, before I was MMC, who had to use clinics. Now that I'm MMC, I can thankfully put my mother on medical aid. 100%. But not everyone becomes MMCs or gets these positions, because I want to remain related to people who is now on the position that I was before. And I want to maintain myself in those shoes and think, how did I feel when my mother had to go to clinics and she had to go at 4 o'clock so that she can get in line early. And then she gets helped at 7. Exactly. Or now, I deal with the reality of things. Like I said to you, statistically, the report might be accurate statistically because there's a certain model that they use. But the reality, that report must speak to the reality. And currently, unfortunately, that's not the reality. So one of the priorities is the elderly, like my mother. Because every single, your mother, absolutely, if you have, if your mother's still alive, in the city of Joburg, your mother's my mother. Your father's my father. I want to look at it in that way. So if I don't want my mother to stand like I didn't want my mother to stand in the queue for as long as that, that's one of my priorities, to say we will bring respect and dignity back to the elderly in this city once again. And then, of course, under health, the environmental elements within our communities. There's environmental hazards that we need to deal with. But then there's drugs. The drug plague, we are going to be very strategic and decisive on that issue in all communities. Then there is the expired food issue. Local shops, restaurants and other big brands that there's notions of expired food that's being sold to our people. one of the things we are going to do, they're going to feel the presence of the health department. I'm telling you now, if there's expired food found anywhere, you will be closed down.
Come, Ashley Sauls. MMC, just as a third question, how important is it, just for both your health and social development departments, how important is it to improve the quality of healthcare for the residents of the city, especially in the context of the pandemic?
Yes, of course, in the context of the pandemic has affected all of us very, very drastically. But what it also has done is that it created a negative atmosphere. There's this sad and somber cloud over us as a city. But once, as we focus on dealing with the realities of that, for example, vaccination, making vaccination available, making vaccines available that's easily accessible to anybody within the city, right? And I think there's about 27 non-medical sites across the city that's available. There is 24 medical sites that's available for easy access for vaccinations. So you deal with the realities within a practical way. But then also we must have an approach of not just managing, but having a commitment to move beyond this season. And I believe that we are close to moving beyond this, right? And get our hope back, get a new sense of drive for life back. So I would like to see our department also speak to three parts, I believe, of a healthy lifestyle. It is a physical side, there's a mental side, there's a spiritual side. When you balance those three, I believe that is an overall health experience. And so all stakeholders has a role to play in the overall health of the residents of the city. Physically, it's our clinics, it's our doctors, it's our nurses. Mentally, it is our social workers, it is our psychologists, it's our social workers. Specifically in my department, we have them that has to help with the psychological element of a healthy lifestyle. Then there's the spiritual. No matter what spiritual belief you have, but connect spiritually. That's where all the stakeholders that partners with us, faith-based organizations, all types of faith-based organizations, whichever your disposition is. But let us now hold hands, come together, and ensure that we create an overall comprehensive, healthy lifestyle. I put it like this, TT. I can't, but we can.
Absolutely. That is a nice link to my next question, to say, just in terms of creating awareness and education, we had a brief conversation about this off camera, but the programs and campaigns, perhaps especially with social development, for people to get to know, rather, what's available to them, services that are available to them provided by the city. How important is that aspect, and how are you as an incoming MMC championing that?
We're going to have to, our officers needs to be on the ground. That's the first thing. Not those nice black leather chairs and long boardroom tables and aircons. And aircons. Our department is more, it connects with people more than any other department, right? One of the 7 priorities, the 7 mayoral priorities in the city, one of them, apart from getting the basics right, one other one is to be a city that cares. I believe that particular priority speaks directly to my department. So this sense, and I put it like this, we need to restore the heart of government. People must feel that this city cares. And through my department, we're going to make 100% sure that people feel that we care. And our officers, like I said, in this department must be on the ground. We must be out there in the city, serving people, helping people. Myself, I didn't get, MMCs are driven. I'm driven. I don't drive myself anymore. How nice.
Levels.
I don't drive myself anymore. We have blue lights so that if there's traffic, we can easily bypass.
Yes.
But it's not, that is not for status. That's for productivity. I'm driven so that I'm able to continue to work even if I get to a place. It's not so that I can chill in there and act like I'm some I don't know what.
Okay.
It's not that. It's my protector is my family, not my servant. So we got to have that kind of mindset. We are here to serve that car. It's so that I don't need to worry about petrol. So if I need to go from one region to another region in one day, one clinic, if I need to go to 10 clinics, I don't need to worry about petrol. That's why that car is there, not for status. The blue light is there so that if I need to get quickly from one region to another to address an issue, I get there fast. That's what that is there for, not for status. The higher you go depends on how low you can go.
You have an interesting outlook, MMC, but just let's talk money. In infrastructure investment for the Department of Health, how significant is that? Are you engaging the private sector and other stakeholders in trying to obviously maximize efforts? Obviously the city, the department has its own budget, but let's speak about those partnerships or the efforts that go into infrastructure development.
Yes, now I'm going to lie to you if I say to you that I have been dealing with that. Now, I'm a person of truth and transparency. So I'm going to be transparent with you, Titi. I have not engaged on those elements as yet. It is now day 4, I think, in the office. But as we speak today, I'm having a meeting with the heads of the departments now. Right, the executive director and the executive head for social development, the executive director for health, and we are going to do. They're going to do a briefing session. We're going to get all of this information down. This allows me now to strategize and say, this is what we're going to deal with in terms of when it comes to infrastructure development. But we know that there are challenges around that. There are huge challenges around that. And indeed, we need strong partnerships. Another challenge is that the budgets have to be cut. Right, on certain levels. Why? Because it's been a mess for the past few years. And let me tell you, that's the truth. The truth is it's been a mess. Now, as the current administration, we got to cut on certain things. But of course, health is prioritized. But it is not on the level that you want it to be. But that's only for 4 months. We just passed an adjustment budget the other day. Just for 4 months, we're going to have to bite the bullet. But I tell you, when we come back after June, I'm hoping to see more on investment around our infrastructure, because one of the challenges in many clinics is space. Right? That's one of the challenges that the departments has informed me about is space. Clinics are small and congested and that has to do with infrastructure. And then you have also, because the dependency of the department is on other departments, other entities to do the development on clinics and so on, it then takes too long. There's too many delays and challenges. And so we got to look into those elements as well. But it is key, as you say, that the partnerships with the private sector and otherwise is key for us to expand, to build, and have not just infrastructure development, but the quality of that infrastructure. Because there's no use. You put up some new roof or gutter, and then when there's a heavy storm, that roof blows because of poor workmanship. So we got to emphasize when it comes to infrastructure as well, that we have our health facilities in good condition with quality workmanships, because this is for our people. It's for your mother, my mother, your father, my father, our grannies. And you got to know that when you hear working and your mother or your granny says, I'm going to the clinic, you should feel that your granny is going to be treated with respect, with dignity.
She's safe.
She's safe. Young people and all people with chronic issues or just normal issues are assisted with dignity and care. And that's what we want to restore. I'm going to say it again. We seek to restore the heart of government.
MC, just lastly from my side, and perhaps on a lighter note, what don't we know about MMC Ashley Sauls I? What would you like the residents of the city to know about you?
What do I want them to know about me?
It could be about your political, you in the political arena. It could be, you can want to share, something personal that you think, like perhaps you like dancing. I know some MMC, H.S. Ondruko said she liked dancing, MMC not play soccer. So it's up to you. I know.
MMC not play soccer? Yes. Well, okay, something interesting about me is that I'm an online influencer. Yes, I've got a page of a character, a comedic, humorous character that I've created that has about just under 90,000 followers on Facebook.
Really?
Yes.
It's interesting. What inspired? Are you a comedy man? What inspired the page?
Yes, I like to make fun. I like to make people laugh. I like to see people happy, And so I created this humorous character called Ombiza Funny Park, and people surprisingly love the character. So it's just satire. It's just a character that I use, and you would never think that I obviously am. I actually have an alias.
I would have never.
Exactly.
Now the residents know.
Now the residents know. But when it comes to my work,
there's no
jokes,
satire.
No jokes.
MMC, thank you so much for your time. It was an absolute pleasure.
It is so nice to be here. Thank you, Titi, for having me.
Hi everyone, my name is Siyanqoba Mthethwa and you're watching Joburg Today.